So mercury, this metal, there's several different forms of it, but this metal mercury is one of the most thyroid disruptive heavy metals. And the reason being is because it interferes with iodine metabolism, which is needed for thyroid. It disrupts selenium dependent enzymes. So selenium is needed for that thyroid conversion. And then it causes some mitochondrial issues inside the tissue itself. So we're going to talk about all those today. But before we jump into that, the World Health Organization has designated mercury to be one of the top 10 most dangerous chemicals to public health. So that's always fun. And then it's shown that the half-life of inorganic mercury in human brains is several years to several decades. And that's just a half-life, remember. So that's how long it takes for half of it to get out. So it's going to be around unless you do something about it. Is basically what I wanted to get with that kind of stat there. So this was just also another fun fact that I pulled from a study here. So in addition to the brain, mercury is also deposited in the thyroid and breast tissue, myocardium, which is heart, muscles, adrenals, liver, kidneys, skin, sweat glands, pancreas, enterocytes, which is your intestines, lungs, salivary glands, testes, and prostate, and may be associated with dysfunction of these organs. So mercury can do a lot of things in the body. It can disrupt a lot of functions other than thyroid. So we're going to talk about thyroid today, but there's a lot of other functions within the body that it can definitely disrupt as well. Oh, mercury also deposits readily in placental and fetal tissues and is found in breast milk too. So you can pass this along. So the big picture, kind of what I wanted to kind of review today just with the thyroid. So the thyroid is not just a hormonal gland, right? It's a high mitochondrial area. It's selenium dependent and oxidation sensitive. So it's really sensitive to inflammation is what that means. So mercury in of itself increases oxidative stress. So at the cell level, it depletes key cofactors for your thyroid. It impairs hormone conversion, and then it can trigger immune dysregulation. So the autoimmune realm of things as well. Mercury can be the driver behind that. So whenever someone has persistent thyroid issues that doesn't respond as expected, heavy metal burden such as mercury is very much considered worth looking into. So symptoms, what kind of symptoms might you have if mercury is involved? Brain fog is a big one, cold intolerance, hair thinning, fatigue, not improving with thyroid medication. That also can be autoimmune related. Anxiety and adrenal dysregulation, just from the inflammatory aspect of it. And poor response to iodine supplementation. We got to be careful with iodine, especially if mercury is present. And on labs, sometimes you can just look borderline. Maybe your thyroid levels are within range, but you can still have symptoms around it. So how does mercury interfere with thyroid physiology? So selenium, it depletes selenium. That's one of the things that it does. So selenium is needed to convert T4 to T3. And the thyroid contains some of the highest concentrations of selenium in the body. So if we're depleted there, one, we don't make glutathione, which is our major antioxidant. So when I say that it increases oxidative stress, we need more antioxidants to bring that back down. And that's glutathione is our major antioxidant in the body. So mercury it impairs glutathione peroxidase, which is that enzyme, right? Impairs the conversion of T4 to T3, and then it reduces the availability of selenium. So when selenium gets compromised, T4 to T3 conversion drops. And what that means is T3 is our active thyroid hormone. So T4 is a stable version of that. And we call it T4 because there's 4 iodine molecules. And then it gets to your tissue, and then we cleave off an iodine, and it makes T3. And once we make T3, the half-life of T3 is fast. We use it, and that's what we want to do. It metabolizes. But a majority of your thyroid hormone gets made as T4 because it's more stable. And so we transport that around the body, and then it gets to the tissue, the liver, the gut, and then it converts it to T3, and we use it. And that's what we want. But when selenium is compromised, that conversion drops. We don't get as much T3 conversion, so we get more T4 in the system. And then reverse T3 might go up on the labs as well if we're selenium depleted. So What reverse T3 is, if you look at a T4 molecule, it has four iodines on it, and usually one specific iodine gets cleaved off to become T3. Reverse T3 is that it's a mirror image that gets cleaved off. So you have this inactive T3 hormone floating around that we can't utilize, and that's reverse T3. And then oxidative damage inside the thyroid rises as selenium gets depleted, because selenium's helping that oxidative stress as well, and it's doing that by glutathione, right? So it's helping glutathione antioxidant rise up, and so when we're depleted in selenium, that increases the oxidative stress to that area. So selenium depletion's one of the things that mercury does. And then the second thing that it does is it blocks iodine utilization. So the thyroid relies on iodine to produce T4 and T3. Like I said, there's four iodines, three iodines. So if we don't have the base building blocks, we can't make the hormone. So mercury competes with iodine for that receptor site on the thyroid. And so when we take iodine, this is why we got to be careful with it. When we take iodine, it can kick mercury off of that receptor and it can replace iodine. But now mercury is floating around the system, and that creates a lot of oxidative stress, so a lot of inflammation. So when we got to be careful with iodine, but mercury, it also it competes with iodine, right, as for that transport mechanism. It damages the sodium iodine symporter, so that's just a little cellular physiology, so it just damages some tissue, and then it disrupts the TPO activity. So thyroid peroxidase is an enzyme that converts T4 to T3, and so if you create antibodies to this, they call this Hashimoto's. And so mercury disrupts that enzyme activity. And then the third thing that mercury is doing is mitochondrial dysfunction within the thyroid cells. So specifically, it can disrupt your electron transport chain, which is in your energy cycle of your cells. Mercury can block some of these pathways, and you get a buildup of substrate and then not a lack of energy at the cell level. So it depletes glutathione that we talked about, and then it increases reactive oxygen species, which is inflammation. Okay, so thyroid cells, they're very metabolically active and highly oxidative. So mercury increases that cellular stress inside the thyroid tissue, and it makes it more vulnerable to that immune dysregulation, cellular damage, and then we get a functional decline in the output. And so we really need to support it with different things like selenium. Sometimes it's B vitamins, sometimes it's just anti-inflammation, and looking at these different factors. And then the fourth thing, I touched on this, but autoimmune activation. So it's altering that immune signaling, that's increasing TPO and thyroglobulin antibodies. And when we do that, we call that Hashimoto's. So mercury's exposure has been associated with Hashimoto's. It's been increased. It's associated with increased thyroid antibodies, so autoimmune, and worsening autoimmune flares. So that's why we go after mercury whenever we have that Hashimoto's. We start looking into that a little bit more. So when we do standard labs, TSH alone is not going to tell us some of these things. It can, but a lot of times alone is not going to tell us. Your selenium status is not going to tell us. Oxidative stress burden or your TPO antibodies is not going to tell us any of that. So we have to do a little more in-depth testing to know what your thyroid's saying, and also we have to start asking questions of what's your mitochondria doing, what's your selenium status. I don't typically run selenium in the office, but we do supplement with it, especially when there's Hashimoto's. So we need to address the toxic load for your thyroid and not just throw some thyroid hormone at it. So where do we get mercury from? The sources of mercury. There's a high mercury content in a certain fish, shark, swordfish, king mackerel, tuna. Those all have higher levels of a certain kind of mercury in there. Dental amalgams, which is probably the most common exposure. And even if you've had them out, 80% of that stays in the tissue. So 80% of that mercury, even though you have the filling, that silver filling out, 80% of that stays in that tissue until we do something about it. And sometimes we have to do multiple things about it or come back to it multiple times. Occupational exposure, fluorescent light bulbs. If you broke out those fluorescent light bulbs, that's mercury vapors that are inside of there. There's cosmetic products, especially anything that's trying to lighten the skin, that has a lot of times will have mercury in it. Vaccines, thimerosal thimerosal is mercury. And then it can be in the air and water that's contaminated. So sometimes in the soil, we can get some contamination with mercury as well. So those are the most common exposures that we see. Like I said, most of the time I see the dental amalgams, the silver fillings, is going to be our most common way of getting mercury. And even I've talked to people too that have had, they're like, I had those, I used to have mercury fillings, but I had them out 20 years ago and but they didn't do any detoxification, any chelation to get that out of the tissue. So they're still dealing with mercury in that thyroid, in that tissue around that thyroid that's still causing a dysfunction. So whenever we suspect mercury is there, I usually do a history, like, is it still there? Am I seeing it? Am I seeing the silver filling? Did you have fillings at some point? Did mom have fillings at some point that she could have potentially passed on to mercury? Are we having any environmental exposures? Looking at all of that data. And then I usually recommend doing a hair test. So a hair tissue mineral analysis. And the one that we do through doctor's data, there's a specific algorithm that tells me if there's some hidden mercury there, which, because a lot of times it's not going to show on its own because it's in the tissue. So we have to either provoke it to come out of the tissue, or there's some algorithms that tell us, yeah, the probability is really high that there's mercury here. And then urine testing is the other way we do. And I usually don't recommend urine testing unless we provoke it with something to get it out of the tissue. So we see what the true body burden potentially is. So that's the testing. And then the first step is to stabilize the environment, right? We want to make sure we're having a bowel movement every day, because how we have to create an avenue out of the body when we're detoxing it. So supporting glutathione, N-acetylcysteine, or selenium, magnesium to help that conversion. Replete selenium if that's appropriate, and then we're optimizing that mitochondrial drainage pathway. So that's step one. We have to go through and support the body. And then step two, reduce any ongoing exposure. If we still have these, we need to get rid of them, right? Evaluate your fish intake if that's too much in any of those categories with the fish that I mentioned. And then just looking at improving our indoor air quality and making sure it's not coming from that or any of the cosmetics. And then assessing your dental sources. Make sure you go to somebody who knows what they're doing with that, because when they're drilling on that and replacing it, you want to make sure you're not breathing any of that in. You want to make sure it doesn't get swallowed, so we have any mercury that's more of an acute exposure. So reduce your ongoing exposure, and then we start to detox it out. So we're going to bind, usually doing some sort of a binder, some sort of a chelator, and then supporting the liver and bile flow. And then I really like saunas and sweating around this time too. Can really be helpful to get that mercury out and just help get it out. So let's go back to the big picture, right? The thyroid, not just a hormone gland, right? It has high mitochondria. It's very selenium dependent and very oxidative stress sensitive tissue. So it increases mercury, increases oxidative stress at that tissue. It depletes our key cofactors like selenium. It impairs our hormone conversion, T4 to T3, and then it can trigger that immune dysregulation into that autoimmune realm, Hashimoto's. And so as we're just diving into some symptoms, we kind of keep these things in the back of our mind. Like when we have teeth that have silver fillings, that's going to be on the list sometime. It's not an if, it's a when. So we have to detox that out. And that's one of the main things I like to do with my patients that have that, especially because a majority of them are female and the majority of those females have thyroid issues. And so we have to get that out of the tissue. And sometimes what we might need to do is just support that stabilize phase first, right? So we stabilize, make sure we're pooping, make sure we're using the restroom, make sure we have glutathione support, make sure we're doing selenium, and then optimizing those mitochondrial drainage pathways. Sometimes you can do that for several months just to take some burden off of the body, and then reduce the ongoing exposure, work on getting those out when the time is right, and then detox it out. Okay, guys, so that's the mercury and the thyroid connection. So if you're having thyroid issues that have been persistent, we start looking at environmental toxins. There are other toxins that can do it. Mercury is the most common one that I see in my patient population. Do you guys have any questions on mercury and how it has to deal with our health here? Mercury is very neurotoxic as well. That's why they stopped using it, is because it really affects our nervous system pretty big time. It affects our nervous system and in our immune system and regulation. So if you guys want to do any of those tests, we do offer those through the office, and just let us know. You can give our office staff a call and we can get you those tests. All right, guys, we'll have a wonderful week and we will talk to you next Thursday.